Good morning, everyone. Richard, thank you so much for your leadership, and thank you so much for all of the groundwork that you've laid. And I want to thank each and every one of you who are in this room today. It's an incredible group of folks, and I appreciate that we have the wisdom, the wherewithal, and especially the resolve to make this work for the canal and for our community. I want to welcome up our panelists. Please come on up. We're going to introduce, I'm actually going to invite them to introduce themselves, and we are going to start with a question, and I'm actually going to call on you, Carmen, and you, Lisa, to really address this question of, from your perspective, let's go ahead and have a seat. We have enough seats? There we go. All right. From your perspective, so Richard touched on the community schools work, and we've, I think, understood the depth of the statistics and the challenges of poverty, the disparities that our community faces, the implications of what the data speak to around social determinants of health. And these are all underlying issues that have been around for quite some time. Naming them is an incredibly important part of creating solutions, so that we are really understanding the what. So I'm going to ask you, and I'll start with you, Carmen, if you don't mind, from your perspective and given the community schools work as a philosophy and as a way of showing up in collaboration, why now? Why are we ready to tackle this challenge and be successful?
First of all, my name is Carmen Ghysels. I'm the superintendent of San Rafael City Schools, and it's an honor to be here. And I think why now is because there's a convergence of community, of partnerships, of issues, and it's about the whole child. And we can educate the child, but from a holistic perspective, economic development, health, mental wellness, housing, we can't do it all. And that is why this is so important to our district, to be able to partner with these agencies to do the work, because every child has an experience at home and they bring that to school and they learn whether it's a positive or negative. And if we partner together in this instance, it's just going to lead to more student success. So I grew up in the same type of barrio. My parents were behind me the whole way. I had a community. And I think that's what's important, as my experience as a leader in our district, is to have that community. And we can't do it alone. So that's why.
All right. Is it Dr. Santora, if you wouldn't mind introducing yourself and then just sharing a little bit from your perspective, what gives us the opportunity in this moment to forge ahead and to be better than we have been?
Hi everyone, I'm Lisa Santora. I'm the health officer for the county. Me llamo Lisa Santora, soy la doctora del condado. I'm so proud to be here and so inspired to be here because it reminds me of where we were 5 years ago, one of our toughest times together, navigating a pandemic. And the first place that we came to work in partnership was in the canal. It was, it was one of the most important communities, because we're the essential workers of our community live and work. And I'm very biased. I'm a mom of 2 kids, both with the San Rafael City School District, and one's at Davidson Middle School now. And I also was navigating the pandemic as a mom and seeing that our kids needed to get back into school. And it was hard for the community to support all of that, holding the burden of being essential workers and worrying about their students. But what I saw at that time is how we did pull together. Every kid got a Google Chromebook. We had Wi-Fi in the community. As hard as it was, we had disaster relief payments and learned from the community that it wasn't enough for those who were just sick with disease, but we need to give disaster relief payments for those who were exposed to COVID, and I saw that we could do it. And I say this many times, in many ways, as ridiculous as it sounds, the pandemic was easier than what we're facing today. It was one virus, one test, one vaccine, and now what we are experiencing is chaos by design, and this is where we need to stick together, focus, and again, with a very biased lens, our treasures are right here in this community, our kids. This is the next greatest generation, so how do we come together to support them? And it's mutually beneficial. It will make our county and our city better. So So I'm just so proud and inspired by all of you for being here today. Thank you.
Thank you. You touched on some of the work during the pandemic, and I'm going to turn to you now, Christine, because I know and I remember when we were doing that work in collaboration in the community through the Canal Policy Working Group, one of the things that Christine said was, and I don't remember your exact words, I'm going to paraphrase here, but we have the trust to make it happen. And that's certainly something we have. So Christine, introduce yourself, please, and share a little bit about, from your particular perspective, what you've learned, what you've seen, and why now is a wonderful moment for us to move forward together.
Thank you, Chandra. I'm Christina Lilovich, the city manager for the city of San Rafael. I also feel incredibly honored to sit with this group of people, and I think I'll start by saying that foundationally, trust is something that I think we have in a biased way. I think there's a huge strength in the partnership in this room. I feel really privileged to call every single one of you a dear friend of mine. And I don't think a lot of city, county, nonprofit folks in a community like this have that kind of heart-centered leadership with one another. And like Lisa said, when the pandemic hit, to your leadership, Chandra, and yours, Omar, to say to us, full stop, we need to get together right now. We need elected officials, we need city leaders, county leaders, and these nonprofits and the community to come together. We had disparate outcomes with COVID. The numbers were off the charts, and we said, this just can't be. The work that happened there is so foundational to where we are now. The foundation. So when you ask the question, why now? Like my mind goes to, why not 100 years ago? Like this is urgent. The urgency, to your point, Lisa, it's like we were successful together during COVID, but what we're facing now is, like we all know, it's unprecedented. There's chaos. Federal funding is being cut all over the place. If we are not in the spirit of collaboration, then it could divide us. And I know that there's a commitment from everyone here to make sure that we stay steadfast in our relationships. Relationships are everything. And so, yeah.
Thank you. So Maria, I'm going to piggyback off of what Christine just said about relationships mattering. And I know that for children 0 to 5 and the families that first 5 Marin works with, relationships are critical. So from your perspective, go ahead, please introduce yourself. And I would love to hear and have you share with the group here just a little bit more about what do you think is possible given what we know and makes this moment the right moment?
Thank you. My name is Maria Patricia Nigel. I am the Executive Director for First 5 Marin. I first want to just reflect a little bit on what Mayor Kate shared with us in talking about courage. And I look at this room and I look at this panel, and by being out here and focusing on this community, this is what courage looks like in action. It's about doing, not saying. And I have had the privilege of working with many of you here and knowing that you're willing to take the risks, especially when we collaborate together and when we support each other to do the right thing for children and families. When I was driving in here and I was caught in that terrible traffic, I was stopping at a crosswalk in the canal and I counted four strollers crossing that crosswalk. I saw bus stops filled with families. And I kept on saying, this is where the hope still lives. And although these are horrible times, the resilience to show up every day in public and show up to work, show up to caregiving, show up to care for others, despite the fear that is going on, that to me is the courage of our community. That is what we're building. And that lives here and flourishes here. The dream, whatever you want to call it, the American dream, the dream of home and ownership, the dream of agency over your life begins here in the canal. I saw it this morning and I see it every time I come here. So yes, this is the right place and this is the right time And I look at our leaders, I look at Dennis Rondoni, I look at Kate Collin, I look at Nuestro Voces, Nuestro Canal, I look at Parent Voices out here. Those are the people, they're ready. And now it's about us pulling our sleeves up and doing the work, and I know this room is ready to do that.
All right, Omar, over to you to introduce yourself, but also I'm going to invite you, as you've been hearing the panel talk a little bit, to bring in what you think some of the assets are. Maria's touched on them. From your perspective as an organizational leader, what do you see? What are the successes that are emerging, and what do you have to offer to speak to this moment?
Thank you. Buenos días, Omar Correa, CEO of Canal Alliance. I would start why now is like, why not 5 years ago? Why not 10 years ago, 15 years ago? So I want to reflect on that. And I've been working on this for 22 years. So I think Mayor Katie mentioned it, it takes time. And that's one of the first things I had to learn, right? It's like, how can I measure myself? Because this takes time. And I feel, answer the question why now, is the historical issues that have been affecting this community are worse, right? The pandemic, the political context, the economic shifts are making the problem this family have been facing for a long time worse. So holding that sense of urgency. The other thing that I see that's different from 5, 10, 15 years ago is look at this room, come on. Look at this room, the leadership or elected officials, the business community is here, or educational partners. Everyone wants the same thing. So what we have is a shared priority. Everybody in this room wants to achieve the same thing. And that is very powerful. But just having the shared priority is not gonna be enough. We need to have the right environment that enable us to do this work. And that is based on relationships. We have been able to show at the national level what community looks like. Because despite our differences, we have actually doubled down in the things that we agree on. And that's what we are here today, right? And the third thing that I think make me believe why now is because the residents, they have my cell phone number. They texted me. Laura knows when something is wrong with the community or something is not happening fast enough, they are letting me know. And the level of empowerment that I see in the community. I know that for statistical purposes, we call it segregated communities. But when you ask them, do you feel segregated? They say, what are you talking about? This is our community. All I want is a better infrastructure, better housing, better transportation, more economic opportunities. I want the canal to be seen not as the low-income community, but a destination in the county. Because I know when the canal is better, everyone is going to be better. So I'm proud to be here, and thank you.
So we are touching on the heart and soul of community, the trusted relationships that move mountains, the kinds of systemic barriers and opportunities that we can galvanize our energy and our commitment around. So I'm wondering, and this is for any of you, when you think about the power of the individual to create change and how you've seen individuals come together to collaborate, we're looking for a little bit of your perspective on how does that magic work and what kind of successes have you seen? What can we do as individuals and what can we do as a collaborative? What do you see working and where do you see the inspiration and the hope in that individual action and the power of partnership or the power of collaboration to help move us forward?
I think between the district and CAM, our partner of collaboration in our early learning center that we have at formerly Short School. CAM is involved and CAM has a place there and we partner together in that sense. And this year we're excited to say that our TK enrollment has increased almost, I don't even say double, but it's just amazing what we're getting from the community. And I think it has to do with our partnerships in our early learning center and hoping to do that even more and more extensively in the future. So that's one example from our perspective.
I'll take that. I'll take it an opportunity to tell. I'll try to make it brief. Sarah, keep me accountable. Some magic happened in this room about, I don't know how long ago it was, 5 years ago. We did the lighting project in the canal, and it was a beautiful partnership. It started with individuals at Dominican University Canal Line, so Voces del Canal, and they came to the city and said, we want to give a presentation to the city council of this expose of where there's safety issues and lack of lighting in the community. I thought, wow, that's amazing. How can we work on that with you? So we created the group, did an incredible photo expose, had a lot of community input, had a lot of qualitative data. Omar and I were talking, we're like, how can we do this? The professor Dominican, we brought all of those folks into this room. We had the chief of police, the public works director, myself, all the community partners in this room, and we went through all the data together. And what we found was we could solve this together, and we could solve it faster. And the city was really listening, and the county was really listening. The partners were deeply listening to what the community wanted, where they needed the lighting, not like the government is going to tell you where you need it, but where the people said they need the lighting. And we were able to come together and come to the city council meeting and have that evening beautiful presentations. I think Rafael, you were there. And the city council committed over $100,000 to effectuate that lighting change, and it happened within 6 months, and we're still working on it, and it's still underway. So we could not have done that without the community leading that process.
Okay. Our community schools partner with the health services to enroll and to get our newcomer students registered. A lot of the times immunization is a big factor and a deterrent and challenge, and I have to shout out Mr. Pepe Gonzalez, who's our director of community schools, who works with and actually it's a program and a process that's working really, really well, and we are getting our students in sooner than waiting when they come to this country to get them enrolled, immunized, and registered in our school. So that's another partnership that we have. Okay, stop.
Yeah, I would say the pandemic was one of those moments where I think collaboration and partnership was tested. That's what I realized. We have something magical here that needs to be used. The Canal neighborhood became the epicenter of the pandemic, right? 80% of the positive cases were concentrated in this neighborhood. Now, everyone was working towards reopening the economy. But the state of California said, you're not gonna reopen the economy unless you control the positive cases. So that created another opportunity for us to start bringing all this cross-sector approach to respond to the needs of the Canal neighborhood. But it required that we use adaptive leadership, that we move from leadership adaptability to adaptive leadership. And what that means by that is that we need to completely think outside the box. That all the plans that you have developed need to put on the side and really recreate, but invite the residents that were affected by that to be co-designers of the new plan. The public health department, you guys created an equity metric, not mandated by the state of California, because unfortunately the state of California doesn't have a way to serve local communities in time of crisis. They will use, okay, let's use census tracts. Well, sometimes it works, sometimes it doesn't. Or let's use zip codes. If you use zip codes, they cannot disappear. So using aggregated data to serve local communities, it doesn't work. So who knows the community best? The community itself. And it's requiring infrastructure that we didn't have. And Dr. Manuel with Dr. Santoro came and said, okay, we're gonna create an equity metric, and local communities are not gonna be behind any other community in terms of testing or access to vaccines. Well, they can now move from being the epicenter of the positive cases to be the most vaccinated community in the country. In the country. And the work was led by the residents of the canal. Right? So anyway, that was put into equity weapon economy.
All right, quick Maria, you have something? Time check, Sarah? How are we doing?
We've got 10 minutes for this.
And then 10 minutes for Q&A. So we will have questions, so be thinking about your questions, either for the entire panel or for an individual on the panel. I do have a question, but Maria, did you want to share something before I?
No, I just saw the one.
Okay, great. So I want to switch gears to educational equity and a focus on the disparities, the systemic barriers. When you think about getting to, I mean, Omar, your example was fantastic about going from the challenges with the pandemic to being the most vaccinated community. We have that opportunity before us around kindergarten readiness, for example, 3rd grade reading, 8th grade math, and those milestones are critically important. So what are the barriers that we need to galvanize our energy, our momentum, our thought partnership around to move the needle for better educational equity in the Canal and in our county?
So I guess I'll answer that one. I believe our barriers are access to our teachers, the training, the constant development for them, because children are different, and we meet them when they come in through the door with their experiences, with what's going on at home. So one of our challenges is the turnover and dealing with that, and also the training of our teachers, and also dealing with the instances where, you know, some students come in and they've had an argument, they've watched an argument at home and learn. So it's the social emotional piece is also a very big component, especially since COVID. And I think those are two big components for us. Readiness, when we have our children come in through the door, some of them have never even been to preschool. So it's learning those skills at an older age and dealing with how we can best provide that support. So those are the challenges that we meet on a daily basis. Just yesterday, Tracy Smith and I received news that, 14 million, Tracy? Or 7 million, whatever it was, there was a federal grant for social emotional wellness that would have funded our wellness coordinators at the high schools for 5 years, and the funding was pulled. So we have funding for 1 year, but we're not sure where it's going to come from after that. So the unsureness now, this added layer of what's going on at the federal level, is also adding to the anxiety. And just as our students are stressed, so are our teachers. So we're trying to find a way to just keep focusing on what's best for our students. So there's so many different factors.
I could speak a little bit from the early childhood experience and birthing families, and really thinking about how we upstream those supports, those mental health supports, those behavioral health supports, those developmental screenings, and how that really contributes to educational equity down the line. And that interruption, making sure that parents are the first teachers, so giving them the information, the tools, the supports, the wraparound services, making sure that it's no wrong door. Wherever you go, you're going to find the support you need, be it lactation support, be it postpartum support if you're feeling down, that no matter where you knock in the Canal, you're going to find someone who understands where you need to go and what the right place is for you. And luckily, we have incredible, incredible partners. I see Belandra Fregoso from a Parent Services Project back there, dedicated to developmental play groups where parents are at. I think about Marin Community Clinics. What an asset this community has in Marin Community Clinics, and what a support for our families. I look here at the CalAIM work and making sure that all birthing mothers, despite income, have access to doulas, so they're able to get the support that they need. And just making sure that work for birthing families, that work for young children is coordinated. Before they even touch TK, they know what they need, they know who they are, and they're ready to learn.
So I feel they've been tasked to create solutions to systemic issues, right? And before we jump to solutions, I have forced myself to understand the history. Why is they took us to this place in the first place, right? And I'm an immigrant, so I don't know much of the history of the United States, so it forced me to study that. And what I learned is when the education system was designed, it was not assuming the full responsibility of teaching, right? It required the broader community to teach the kids. That's why we have libraries, that's why we have and expectation of the families, parents provide a support at home, the parents' participation. So it required many things that for low-income families and low-income neighborhoods is almost impossible to deliver to them. And all of us have been going to the school board meetings and demanding more and more and more. And the more I learn, I find a lot of compassion for our educators, because you're not just teaching the children, you're responsible also for so many other things. And then the resources are shrinking at the same time. So just going and demanding that you do something more or something different was not enough. So we decided to join you in this battle, right? Because the problems are real, are deep. And those are connected also with infrastructure. Go back to the pandemic. When distant learning was implemented, suddenly, a lot of people realized the broadband access is a problem in the Canal neighborhood. I've been advocating for that issue for 20 plus years, right? Because in urban areas, even though we are surrounded by infrastructure, low-income families cannot access to that broadband service. It's ironic for me to do that. But that was the case. So distant learning really was implemented and elevated the challenges. So we have a lot of infrastructure issues. There was affecting educational outcomes, there was affecting health outcomes. When you see the social determinants of health framework, which is one of the most comprehensive frameworks, it calls out neighborhood infrastructure as one of the key factors to improve. So if that's the case, that's not the responsibility of the schools to build infrastructure. We need to bring all the partners to the table to respond to that. We need to bring the city, we need to bring the county, we need to bring the state, and we need to bring the community to this work. So I will say that.
All right, well, with that as a segue, Lisa, I'm going to ask you, from your perspective, if this collaborative opportunity is successful, what is the tangible outcome, a real result, an impact that you believe we can achieve?
I think that there would be one true door, and it doesn't matter which door. Right now, there are so many different doors. It's very confusing. You need to have knowledge of which door you should go through. You need language to be able to communicate through those doors, because we are not bicultural or bilingual in many of our systems, and we don't communicate across our systems. So you have to share your story at every single door and with resolve in order to try and access services. And we also are not clear about knowing which services are available. So if you are new to our community, there's no guidance, there's no roadmap for how to, is there affordable childcare? How do you get a job? How do you get connected to adult education, to learn English and other employment opportunities? It's a mystery. If you're lucky, you can find a friend who's in the community that can help you navigate, but we haven't mapped out, and I think that's one of the things that a successful community would be that everyone would have a key to the map and know how to navigate, and then anytime there were barriers, we would be able to have these warm transitions where it's not a no, because it's still a no many times. You call, it's the wrong number, you just get no. You're not guaranteed that you're gonna get the person that's gonna be able to find the next step for you or help you in that next step. And a lot of it's infrastructure. One of our projects is data modernization. Many of us work in paper still. We can't share data or share information, and so we're scared of sharing information, and some of it's real right now. We are really considering what information do we collect, because can it be extracted and used against our community? So that being said, we need to take risks, share data, and learn how to be more effective to really being focused on the community, and that being focused on the individual. And I think recognizing that everyone comes with trauma, like you said. I mean, some people haven't eaten that day, their teeth hurt, they haven't seen a doctor, they've seen a fight in their house. And how do we recognize and be a supportive community to that, being truly trauma-informed as providers?
I love the question, Chandra, because we have the answer, and it really is in this room. I think the unique thing that's happening right now with Omar's leadership is this resident-led vision. The community has been telling us for 20 plus years, this is what we need, this is what we want. We have dozens of plans that say all the things that the community needs and wants. And we're at this moment in time where the leadership in the community is saying, let's do some things. Let's stop talking about the things. Let's deliver and be accountable to the things that we already know are needs. So I think we talk about co-creating, and I think one of the things that is really important about the vision and the success of this partnership is that all of the institutions and the systems are willing to shift power and give power to the community and to really do things differently, and particularly what's happening at the federal level. And local government has the opportunity to really have a more heart-centered, compassionate delivery and recognize that we serve the community. It's not the other way around. So I feel like there's an incredible, powerful vision where, maybe building a bridge from this side of the canal to the other to connect community. That's a long-term vision over 30 years. And we're starting to manifest these opportunities and see them come to life, and it's really, really exciting.
Thank you. Can we give our panel a hand, please? Incredible visionaries and people who are willing to meet the moment, so thank you. So I want to open it up. Are there questions in the room for this panel?
All right, I see somebody in the back. Thank you.
Hi, my name is Maria Pech, and I'm gonna say this in Spanish to the district. ¿Qué recursos tiene el distrito para ayudar? ¿Qué recursos tiene el distrito para? ¿Qué recursos tiene el distrito para ayudar a los niños en las escuelas acerca de la persecución a los latinos que están sufriendo con la nueva administración y cómo los padres se enteran de sus recursos?
She's asking to the district, what resources do you have to support the families that are navigating these times with being persecuted by the federal government? And how do the families know about these resources?
Can you hand the mic to that man right there?
Que los tiene Pepe.
Qué buena pregunta, si está enfocado más de la inmigración o de qué recursos federales. Sobre la inmigración, sí, estoy recibiendo mensajes ahorita que están viendo suburbans en el canal, tenemos que tener la comunicación primero y las relaciones. Regañé a Maranta cuando llegué porque no tengo su celular, ya lo cambiamos, pero escuchamos tanta información, tenemos que escucharla, ver si es verdadera y luego reaccionar. Estela, la del centro comunitario de David, dice que estamos en un calm tense, un tenso pero calmados, porque no hemos escuchado nada como el 2008, el 2009 que entraban y recogían a cualquiera. Gracias a Dios no estamos escuchando eso. Estamos escuchando que si tienes un récord criminal, que si has sido deportado, te andan buscando. Entonces, si no, como dicen, si no temas, no tienes nada que preocuparte. Pero en cada escuela tenemos centros comunitarios, tenemos enlaces comunitarios, estamos conectados con muchos miembros de este grupo aquí para poder responder. Si tiene en cualquier escuela, llama a ese centro comunitario, que estamos conectados con todos. Lo bonito de estar en este condado también, estamos ahorita en el proceso de crear un Rapid Response Team, un equipo de recursos rápidos para cuando escuchemos algo, que una familia esté en necesidad, tenemos la llamada al Centro Cultural de Marin, que están encargados de eso, para que puedan ver qué es lo que necesita esa familia y poder enfocarnos en esos recursos. Entonces, estamos en ese proceso porque estamos en esta comunidad. Do you want me to translate in English as well, or?
Heather was saying, that we have lots of communication between the families and the schools. We have hubs of communication. Through our programs, we need to listen to what the families need. We need to understand. I don't know what I'm doing. We need to be able to understand those needs and be able to respond to them, which we are doing through communication and networks with a lot of the organizations that are in this room, a lot of the county and city offices and the sheriff's What's different from now than was before is they were doing big roundups in the early 2000s, and now they are really just looking for people. It's a calm tense, is what a tense calmness, because there are individual searches for people who have, previously been deported or have police records, and that's what they're searching for. So if you don't hear anything, it's okay. However, they are happening, and we are trying to be as communicative with the community as possible. Is that about right?
The county is starting and launching the rapid response initiative with the multicultural immigrant being the hub. So when we have information for a family or student that's displaced, we will be able to direct them there in great partnership with so many people in this room.
Hi, good morning. Buenos días a todos. I'm Priscilla Miranda, and I'll do my question in Spanish and in English. I really want to appreciate Marin Promise for bringing us all together and for such a lovely panel spending their time. Gracias a Marin Promise por tenernos a todos juntos y por el panel que está junto ahorita. Many of us here are part of the system of care, of the system of solutions. We are here because it's something that either we do professionally or we're very much embedded in the systems in some way. Muchos de nosotros estamos aquí porque ese es el trabajo que hacemos o estamos dedicados personalmente en hacer los cambios que necesita la comunidad. But this is a cross-section of folks that are already in the conversation. So I think my question for the panel is, what are we doing at a county level for advocacy to talk with folks who aren't here at this table and whose vote really does count in terms of making the actual differences that we need to see happen from infrastructure and systems? Mi pregunta a los que están aquí representados es, ¿qué estamos haciendo para las personas que no están presentes aquí o que no están en representación en este momento, pero el cual sus votos hacen los cambios que necesitamos para la infraestructura y para los sistemas que actualmente van a hacer cambios en el condado de Marin?
Thank you for the question. And we do have incredible representatives from our Board of Supervisors in the room and other county officials. But on the panel, I want to turn it to Christine first and see if you can respond to that, and then others may want to jump in. Yeah.
This might work. Yes.
Thank you, Chandra. I think we do have to expand the network. We can't do it alone. We've got this great partnership in the room, but I think it's a really fantastic question. I think we need to lean on our legislators at the state level and really try to figure out how do we help them do their job and respond to our local needs at the same time. I think the infrastructure question is a really big deal, and the city has a huge role in the infrastructure and urban planning, and how do we do that through an equity lens. It's going to be challenging. We're already, as Carmen said, we're seeing federal funding being pulled from transportation, anything that has the word equity in it, which is all over the city's values and all over the city's plans. And so we have to reach out to others and learn from other counties, other cities, and look to others that are leading in a space and bringing in. I know this is, everybody knows this, but we need money. We have a vision, and we need the funding and the support to move it forward as we incrementally see the federal funding go down and down and down. Bring us up, Marin.
Yeah, I can. No, I can just say I'm looking out the room and I see a lot of our Marin Children and Families commissioners here today, and they put their money where their mouth is. They are supporting an organization of parent advocates called Parent Voices to support them. It's not enough, but it's something, and I feel like we need to put our money where our mouth is. We often say we need community support, but then we do not fund that. We do not respect the expertise of the community. We borrow them when we need them, and that is not the true voice of community. And so I really challenge this group to think about, how are you supporting authentic community voice? What does that look like in your organization? But not just for your organization, but for the entire community. And I think that is a way that we can really support that the community has a seat at the table.
I would say there is definitely voices missing here, but there's a lot of good voices here. I think this collective group has so much influence to get things to the finish line. And this is the beginning of the conversation, it's not the end. And tomorrow, we're gonna have the residents coming and vocalizing, shaping the vision for the neighborhood more. So you all invited to come and up to the event, Nuestro Canal, Nuestro Futuro, when the residents are gonna start showing us what is the neighborhood they're gonna have. Also, I wanna point out that you see on your right side, an amazing project that is happening here in support with the city of San Rafael, with the community. It's gonna be a beautiful soccer field. We're gonna be able to bring more programs for the kids in the canal. So it's a lot of good things happening, and we have to do more. And we have to bring new voices to it. But I think this group are gonna be the ones helping us bring those voices here.
Leader. I just want to share that I'm still learning. I think that's part of the journey is learning. I was taught in a system, defined by a system, and how do we learn as leaders to shift power? And that's a big, we say shift power, but you have to learn how to do it and learn the systems that you work in and see. Be patient sometimes, because sometimes you can create even further resistance by moving too fast and not learning where the system is in its readiness. And so I think part of this is still being a learner about shifting power. It's been, like you said, this is historic. There's many teachers that have been out there for decades trying to instruct communities of how to shift power and really be in that space of co-creation. And I think just it's challenging, I just look at public health, like the vision that I hold, challenging our staff to think and do differently. And there's a lot of assumptions that we make that people are on the same page, but those are all assumptions. And so how do we, again, as leaders, lead with heart and share that vision and hold ourselves accountable to the change that we want to see? And the other one I see is that in public health, we also hold a privilege and a mantle of communication, and we have to do a better job at communicating. The reason why we are here in many ways is because I know from a public health perspective, we can sound very scientific and we don't connect with the community. And so how do we learn to be better communicators so we can galvanize support, not just only from this room, but from all of the county of Marin who can see the treasures that I see, and that is not the truth. Many people do not see the canal as the treasure that I see in front of me and the future generations that I see. We have significant racism in our community, and so how do we be thoughtful in our communications and help communicate together in order to shift the perspective of our larger community? Because if we're going to get money, we need to know how to ask for money and make it a good ask. So, but I agree, we need money. We need to know how to ask for it. So.
We have time for one very, very quick question with one response.
Hi. I can be quick. My name is Stephanie Plant. I own a business down the street near where Target and Home Depot are located. And I just wanted to speak to that issue of partnerships and asking for money. We collaborated about 5 years ago when the city council was being asked to create districts at all. And this is the #1 district, I agree with you. But Omar and I think, created an alliance that I'm not sure that we were all super aware existed between the residential community and the business community here in East San Rafael. And I'm not sure that we all knew that we liked each other, and I think what we found was that we did. And I would just remind everyone that that is a partnership that can be tapped again. Yes. And we got ourselves a great council person and great representation, and the business community, while we may not vote for, we may not all live in San Rafael, we do come here every day, 8 and plus hours a day. I chair a committee for the San Rafael Chamber of Commerce. I'm very proud to have been affiliated with the Chamber for a very long time. It's called the East San Rafael Working Group. And I did invite all of our members to come today. But I think I'm the only one that's here. I do think, Omar, that is something that we can look back to. We were able to create great momentum to get ourselves a council person, and I'm sure we could get whatever we want, frankly, again.
I can say, I agree because I hate it.
All right, well, thank you, everyone. Final thought, we are building individual agency. We are building community power. We are shifting the narrative, and we are doing the work to shift laws and policies to produce better outcomes for our community in the Canal and across Marin. Thank you again to our panel, and thank you to all of you. Thank you.
We're going to take a 15-minute break, and after that, we're going to hear from Sarah Hobson of the West Marin Fund about how this work would play out in West Marin, and then we're going to hear from some national visitors about how this work is playing out across the country. Thank you.